It is paramount that the patient is put first, second, and last. They must be included. However, that's easier said than done, and I recognise that. Also, you have to be careful it doesn't become a tick box exercise. We've carried out surveys in numerous countries, and the greatest respect, Boon, lots of healthcare professionals say, oh yeah, I included the patient. I told them that they needed this, and they said yes. It was a joint shared decision. No, that is not shared decision making. You need, and it's very difficult for healthcare professionals, especially how busy everybody is at the moment, but it needs to be a discussion to explain. In our previous question, when Boon was explaining about a lady that was obese and how to change her lifestyle, it needs to have that longer conversation to see the patient as a person. They are not just a patient presenting with AF. Behind that AF, which may only last minutes, it may last days, is a person trying to lead a life like you and I, and all that that entails. So you need to have that time so that the patient builds confidence with the healthcare professional, and they need that confidence to empower them to be able to have open discussions with their healthcare professional. Now, in a 5-6 minute appointment, you can't achieve that. So it is difficult. We recognise that. But time spent at the beginning for the patient to get to know the doctor and the doctor to get to know the patient actually saves time in the long run. And if you take them as a whole, find out more, and also signpost these patients and their caregivers to recognise professional organisations for patients, whether that's AF Association or Arrhythmia Alliance or whatever association it may be for whatever condition. They often have checklists or discussion guides or information on how to engage with your doctor. And certainly with ours, all our resources are written and endorsed by medical professionals, and they welcome it because it actually saves time in the long run, but it also gives the confidence and the knowledge to the person who they're unwell, they may be emotional, they may not see doctors very often, and all too often they say, oh, I feel silly to ask that question, or I feel he will think I'm ignorant asking that question. We have to overcome those barriers because we know, and research has shown, that an informed patient about their condition responds far better. Outcomes are far better. It's also easier for the healthcare professional. So in a nutshell, in answer to your question, we must involve patients and their caregivers in all decisions and have the time to explain and for them to be able to question. So why are you recommending this? Why am I not suitable? Why am I suitable? Whatever the question might be, because if the patient understands, they're more likely to adhere to their treatment, therefore outcomes should and will be better.
So once again, everything that Trudie said is so relevant, and I don't wish to repeat that. I'd like to talk about something slightly out of the box, which is called placebo. And in my mind, the patient-doctor relationship is what anchors down a very strong placebo effect. Now, the placebo effect is not trivial. It's not something to dismiss. It's actually one of the most important agencies for change. And when we start the conversation involving the patient, educating them, making them feel empowered, and involving them closely as a joint decision maker in the process, what we're actually doing is ensuring a high degree of compliance. And not only that, the compliance and the positivity that comes with knowing that you're doing everything you can often be all the difference. Now, I told you that I did my PhD in the role of the autonomic nervous system in atrial fibrillation. And throughout my career, boy, have I seen so many atrial fibrillation episodes get triggered by emotional states, stressful states. And stress can also mean coffee and alcohol or lack of sleep. all these are forms of autonomic nervous system stress that can trigger an AF state. So actually, if you think about what drives atrial fibrillation, it is not only the hypertension and diabetes and ischemic heart disease and everything we would traditionally be taught about. I'd like to say that actually an emotional centeredness and self-regulation can be something that helps engender good behavior, or at least good compliance with the advice that we're giving. And that can only be anchored down by a phenomenally good patient-doctor relationship. So I think involving the patient in the decision-making process means that you will have to take time as a healthcare professional to explain why we're suggesting everything we are, and then you are going to be answering whatever questions that they have. And it shifts away from this traditional model where the surgeon would come in and say, this is what you need to have done. And really that shift is what allows patients some agency. So they feel that their actions and responsible behaviors can make a big difference, because it is a relationship between the patient and the physician. It's not only the physician delivering the treatment, it's both things happening at once to optimize the outcome for a successful atrial fibrillation treatment strategy.